What are we talking about today?
We are talking about what to expect from integrative mental health and who it's for,
Yes.
which is like way bigger of a topic than fits into a 30-second video. So we'll see if I can do like a broad overview.
Yeah, absolutely.
You had asked me a question before we started recording that keeps sticking in my head about why it is that we always feel worse before we feel better when we're getting recovered. And there are like medical reasons for that. If your body has been overstressed and burnt out for a long time, when you start to get care, you get enough rest and you start recovering some of that, your body is going to go, oh, I feel so much better, and like try to get you to sleep a whole lot.
And the same is kind of true if you take supplements, yeah? Like, oh, you're deficient in something, you start supplementing to give your body what it needs, but you have that washout or recovery period.
Yeah, I had a teacher explain it once as if you've been running on adrenaline for long enough and you don't have to run on adrenaline anymore, there's a gap between the time that your body continues running on adrenaline, like pulls that gas out, and then you don't have the rest of your gas tank full with anything else. So you have to like rebuild from there. There's like a disconnect between when that drops and when it comes back. But answering that question is a little bit putting the cart before the horse.
Sure.
Because there's still the question of like what to expect in the first place.
Yeah. So integrative mental health, it's a buzzword. Integrative psychiatry, holistic mental health, has a lot of umbrellas, but essentially who's it for and what would they expect is different than maybe going to their psychiatrist, therapist, or primary care provider.
Mm-hmm. So integrative mental health is going to look different in different offices because it's so different. It's not cookie cutter medicine, but broadly, we're looking at each person as they walk into our office holistically. Like, what are your experiences? What has worked for you and what hasn't worked for you? And what stories does your body hold? And an intake might include like, when did these things occur in your childhood, in your adulthood? How do these patterns work for you? When did they start? And what does your day-to-day life look like? Where an intake for other types of mental health, if you're seeing a psychiatrist or primary care, you may have 20 minutes to tell them real fast, I'm too anxious to function, help. And they're going to be like, cool, take this medicine. And like
so symptoms, like it's very symptom focused.
Yeah. And sometimes in integrative mental health, it's valuable to do that because we need to be able to get you calm enough to be able to do some of the healing to get on the other side. What's the difference between integrative mental health and like psychology? You might do an intake over 3 visits in psychology, really spending time to like really get to know you as who you are and where you fit into the world. And we don't need to go quite that deep into the sources of all of your traumas when we're looking at it from a naturopathic perspective. Like, that's important and it's part of who you are, but retelling it is also re-traumatizing. So we want to give space for who you are now, over the stories that we tell that keep us stuck in old patterns. So we might take longer than a psychiatrist in an intake, but it'll be less time than a psychologist or a therapist.
And who, like, in your practice, like, who fits our model of care? Who do you see? What kinds of things are they looking for, and why might they choose this like big picture holistic approach versus maybe just counseling or just getting a prescription for anxiety?
Yeah. So for a lot of people, the symptom control style of mental health work is really valuable and it does everything they need it to. And then there's a lot of people for whom it doesn't do enough, or they try several medications and they have bad reactions to all of them. They're looking for another option. And there are a lot of people who look at the way the medical model approaches mental health and just feel icky about it. And there's a lot of people in the medical community who are trying to shift some of those ickier patterns, but also there are other options. And I'm looking at things like what medications worked and what didn't, what's going on in your genes that might affect that. And also, like, do you have nutrient deficiencies that make you feel more anxious? Are you tired because you're low in iron or like low in vitamin D or something like that? So if somebody is not getting the support that they need in another avenue, they may come to Amanda or another integrative mental health practitioner looking for like more answers.
And common misconception, while we don't necessarily jump in with prescriptions and prescribing, we do take the approach of it being a totally appropriate and necessary tool, right?
Yeah. Yeah. In naturopathic medicine, we talk about removing the obstacle to cure. And different providers look at that differently. And the way I look at it is what is the thing that is between you and living the life you want to live? And if that's panic attacks, cool, let's give you a medication to make panic attacks stop. And we can build up new patterns and new systems and then take the medication away slowly. And then see how you do there. Like maybe you're having panic attacks because you're low on a nutrient, or maybe you're having panic attacks because prior trauma, in which case let's find you a trauma therapist. And then in the future, we can try removing the medication again.
So it's like acute care. It is a totally appropriate acute care approach.
Yes. Yeah, absolutely. It's like impossible to actually remove your own obstacles when your mind is in your own way. And figuring out how to make all of that easier is the way to be able to remove all those other obstacles.
Absolutely. Absolutely. Do we, have you seen patterns in who we see patients, their struggles or is it really across the board?
I don't know who I don't see, so I don't know how to make a big comparison, but I see a lot of people who have, like I mentioned earlier, have had reactions to medications and feel really uncomfortable with that as a way of proceeding. I see a lot of people who've never tried a medication before ever, and they don't even want to go down that route. And sometimes I'm a great provider for that. And I see people who really resonate with like herbal medicine and with working with diet and lifestyle as the approach that they want to take. I see a fair number of people who don't know what's going on in their head and need diagnostic help. And then we'll do screenings and go through diagnostic conversations to figure out what is happening in your brain and how can we support it. I see a lot of people who are not diagnosed. How do I say this? They may have either been misdiagnosed or not appropriately diagnosed in their past. And there's a giant like question mark of why am I still anxious or why am I still so depressed? And sometimes I'm able to figure out with you, like what's actually happening in your brain. I see that with a lot of people who missed screening for ADHD when they were kids, because we have a much different understanding of what ADHD is now than when a lot of us were children.
I don't resonate with that at all.
Yeah.
So basically anyone who the kind of one model of care doesn't fit.
Yeah. Medicine is not one size fits all. And like the type of medicine that we do at Amanda is also not one size fits all. We try to tailor it to the person, but we're not a home for everyone.
And I think the thing that is the really unique value driver for us that I love so much is that our toolbox feels more robust than the average providers.
Yes. Yeah, we have a lot of tools available. And sometimes those tools are, let me refer you to a specialist in this field. But we can use medication, we can use lifestyle, we can do dietary change, we can do herbs and supplements.
Flower essences.
Yeah, flower essences and homeopathy, if that resonates.
Counseling.
Yes. Yeah, we have a lot of options. And to circle back around to that first question that I put the cart before the horse, like as we're sorting things out, sometimes it gets harder and more complicated as we're trying to understand what's happening in your body and in your brain. And like that's part of the process is you have to
go on the threads.
Yeah, as we pull on the threads, like you start realizing stuff about yourself, and maybe there's a grief process, or if we're fixing some sort of nutrient deficiency, it can take a little time for that to work, and we just have to like coast for a little while before we do our next thing.
Excellent. Well, thank you. What are we talking about next time on Hey Amanda?
I don't know, maybe we should take some suggestions.
Counseling, trauma care.
Ooh, yes. Yeah, I'll put that on the list.
Excellent.
Cool. Thank you.
Thank you.